My name is Kelly Talby. I'm the Director of Policy and Strategic Partnerships here at Kentucky Voices for Health, and we typically come to you in the afternoon, but there are so many important meetings that we have to participate in, so we do apologize for any inconvenience if that threw you off, but appreciate you joining us in the morning today. Alex, you can go on to the next slide. Many of you are familiar with the Thrive Kentucky campaign, but if you are new here, please know that our network of partners, some of that you just saw the logos on that welcome screen, and then we'll have a list of who you can reach here on an upcoming slide. But here are some principle and some of our more aspirational statements that help drive the work that we do collectively. We do want barrier-free, accessible, affordable safety net, Kentucky, where everyone can have their basic health-related social needs met. And we want that welcome mat approach, be it through staff, through our own organizations. There is no reason that we can't allocate the funds that we do have and the support systems that we do have to work better and more smart for what we actually need day to day. You can go on to the next slide. Here's a list of those partners that I mentioned that do make up the Thrive Kentucky campaign. Many of them are on the call today. You'll get to hear from them directly. And we love hearing from you all. You can go on to the next slide, Alex. It's how we help grow our network. Quick shout out to our Thrive Kentucky 2025 sponsors, Humana and the Kentucky Primary Care Association. We cannot do this work without our sponsors. It helps us to continue bringing this education free and offering continuing education opportunities for community health workers and licensed social workers for free. So it's very, very important. If you're ever interested in joining that sponsorship effort and helping us continue this work, definitely reach out to me. And thank you to whoever just dropped my email in the chat. You can go on to the next slide. Here is just a handful of remaining events for the year. We have one more in-person roadshow. It will be in Richmond on Tuesday, November the 4th. We have a CHFS virtual forum. This is where we join leadership with the Cabinet for Health and Family Services. They'll have a virtual forum mid-November. And then we have one virtual roadshow. Sometimes folks that join us in person throughout the year like to have a recap at the end of the year. Sometimes if you can't join us in person, it's just an opportunity to still capture that more broad roadshow presentation, some of the topics and more detailed presentations that we don't have time to cover in these updates. You can go on to the next slide. So here's some housekeeping. We would appreciate if everyone can stay muted. We do want to try to address any questions in live time because it helps. If you have a question on your mind, odds are that someone else is also thinking or curious about that. So it helps if we can answer it in live time so that everyone gets the answer. And then, of course, if there's something that we can't get to, we will follow up in Alex's post-meeting webinar informational email and try to give that information to everybody. And we did recently switch our view. So I'll just remind folks that you're going to be able to see speakers, but you're probably not going to be able to see each other. If you've been joining us regularly, you might have noticed that we got a couple of Zoom bomb episodes. And so we are trying to manage the room a little differently, but still have a lot of user involvement. But in the event that we have another unwelcome guest, that is why the view has recently changed. We want those questions, drop them in the chat. Holly is going to get on them as quickly as possible. I see her there. And then CEUs. This is very important for anyone here today, certified community health workers, social workers, and then anyone who can independently report your continuing education or professional development needs, like targeted case managers, nurses, psychologists, you name it. we have to have you fill out that evaluation. So in Alex's follow-up email after today's meeting, please complete that evaluation. Takes maybe 3 or 4 minutes. You can let us know how we did, but that is how we collect the information for our records to get you the continuing education certificates that you need. And yes, all the materials and recording will be included in that email as well. Let's go on to the next slide. And then I'll pass the virtual mic to myself and get right into it. I thought we had an agenda slide. I'm sorry. So the federal update, I'll pivot gears here, and you can go on to the next slide, Alex. I late last night was trying to reality check with myself because in mid-September, when we last gave you all a federal update, we were a couple weeks shy of that September 30th deadline. September 30th is, of course, the end of the federal fiscal year. And unfortunately, the pendulum has swung and Congress failed to pass a budget or a continuing resolution. And so we are day 21 into a federal shutdown. A lot of the routine and more directly impacted programs that you hear about during federal shutdowns, like WIC, all of the concerns are afoot. And on top of that, Congress has now, or the Senate has voted now 10 times to pass what they call a clean continuing resolution, but that does not include extending the enhanced advanced premium tax credits. So just a reminder there, millions of Americans, including about 100,000 Kentuckians, without that enhanced advanced premium tax credit extension, do not know at this moment what their health care is going to cost them next year, meaning they might not be able to afford health care at all. Right now, in this moment, Idaho is the only state that has leaned into open enrollment. And so they're kind of going to be the canary in the coal mine on grappling whether or not they will be able to afford healthcare coverage. If Congress does not extend those enhanced premium tax credits, but for the rest of the country, beginning on November 1, and you'll hear from Priscilla later today, it is a reality that unfortunately too many of us are concerned about. And then I lost you on my screen. There you go. Also, during this time, we are seeing the Trump administration make some decisions as a result of the shutdown in services and funding. Thousands and thousands of federal workers have been fired, many of whom carrying out very critical services. All federal employees are very important, but some of them carry out very essential and critical public services like the Office of Special Education Programs and about a fourth of the U.S. Centers for Disease and Control Prevention. And as we are leaning right directly into respiratory virus season, laying off a quarter of the CDC is a little concerning. Billions of dollars have been blocked for infrastructure projects. And so for Kentucky, more than a half billion, apologize for the technical inconveniences there. I was speaking to the infrastructure projects and the billions of dollars that have been blocked recently as a result of the shutdown. Hundreds of jobs in Kentucky will be impacted, and more than a half billion in Kentucky projects alone. On October the 10th, the USDA Food and Nutrition Services issued a letter to all 50 states indicating that November issuances must be held. And that is a $103 million direct hit, much larger, of course, if you get into the socioeconomic and local impact and what that means for our local economies. And unfortunately and tragically, to add insult to injury, just in time for the holidays, right? There were quite a few rumors stirring late last week and over the weekend that it might also affect October holdover balances, that if there were remaining balances and if the shutdown does continue, would that October 10th directive from the Trump administration impact those remaining balances? And it does not appear that that is the case. We will, of course, try to inform and update everyone if that changes. But please know at this time that it does appear that November issuance of SNAP, if the shutdown continues and persists, states will not be allowed or able to issue those funds to Kentuckians or any American family. The not allocated TANF payments for the month of November that the Trump administration has made moves for. The Beshear administration recently announced that Kentucky will be covering those TANF payments in November, which is a huge relief and bright spot. But he has made it abundantly clear that that will not be an option in December, unfortunately. You can go on to the next slide, Alex. Uh, as you just heard, the thousands of federal employees who have been fired as a result of this federal shutdown. The Beshear administration has done something like this in the past, and it's necessary again, unfortunately. But the Team Kentucky for Fed Employees.ky.gov, it's kind of a mouthful, but we have it linked there. This is where if you are working with any displaced federal employee or a federal employee family, this is where they can go to virtual career fairs, speak with career counselors in live time, search through the state government portals for Kentucky job openings. And this is also a great place if they need to work on unemployment benefits claims, direct links, and a step-by-step walkthrough on what that process is like. So please keep this handy for any of the clients you serve that might be federally displaced families. Go on to the next slide. Now more than ever, oh wait, did we switch the call to action slide? Well, I'll talk about the immunization access. In mid-September, we were ahead of the Advisory Council on Immunization Practices, the ACIP committee. There were some congressional hearings going on about political interference in immunization policies, and some of that has dissipated. And I'm mildly happy to report that at least for the respiratory season, COVID, flu, and RSV seem to be back on track. I cannot, with as much confidence, let you know that all routine immunization schedules are on track again, but at least in this moment, COVID, flu, and RSV do seem to be on track. What is still confusing is the accessibility. And that is a multifaceted and pronged problem. So I did want to reuse and recycle the Kentucky Board of Pharmacy letter here. They issued it early September in advance of all of the confusion. And this is important because the majority of Americans get their routine immunizations through a pharmacist, either at a Walgreens, CVS, or someone like me who just walked into Kroger the other day and used my Kroger pharmacy to get my COVID and flu boosters. Go on to the next slide. If you do want some handy resources on the who, the what, the how, the when, this is one example of a handful of graphics that you could access right now. For those who know me personally, I do kind of dork out on epidemiology podcasts and blogs, and this is one who has organized a pretty robust updated guide to the 2025 fall vaccines now that we have the guidance. And so if you like this type of graphic, please know that there's others available for COVID-19, RSV for pregnancy, RSV for aging adults, and the monoclonal antibodies option for babies for RSV. And it also gives you a much thorough breakdown within each. Go on to the next slide, Alex. And I will be sure that we get the call to action slide in the follow-up materials that you get in the slide deck, but there it is. It could not be more important than now to call on your congressional contacts. The Hill is quite a buzz, but somehow the negotiations are still not fruitfully giving us some relief, and the shutdown, which should have ended yesterday, there does not appear to be much end in sight just yet. So please raise your voice. Please pass these phone numbers out to everyone you work with. Let them know it is so important that we reopen the federal government. We've got to extend those enhanced premium tax credits in time for marketplace open enrollment that opens in just a couple of weeks. And if the federal shutdown does continue, the direct impact and the pain will be felt larger and larger as time goes on. So that is something that is not necessary. We can absolutely stop it and prevent it and turn this back around. But our federal lawmakers need to hear from us. And so I will now pass the virtual mic to Dr. Sheila Schuster, who will kind of give us a more state update on where we are in the Kentucky interim.
Thank you, Kelly. And I do want to talk about what's going on because we still have a lot going on here in Kentucky. So next slide, please, Alex. So the interim session started in June and it will end on November 30th. And I think most of you know that they can't pass legislation, but it's a great time to be in touch with your legislators. It's a great time to follow the task force meetings, and also a good time to see both the House and the Senate versions of the same committee coming together to talk about issues. So you get both that House and Senate perspective. Next, please. So the interim task force meetings are about ready to wind down, and we've been posting those and their chairs and co-chairs. And so most of them just have a single meeting left. The ones that I think most people are following is the artificial intelligence. The AI task force has been very interesting. We testified at that a couple of meetings ago about being sure that our kids are protected from AI chat boxes that are pretending to be therapists, and they really are not, and are sometimes leading to disastrous consequences. We've been interested in the disaster prevention and resiliency, the housing task force, which Adrian or George will talk about later, and then the Make America Healthy Again task force, which Jessica may mention because they've been focusing a lot on food. Next, please. So here's the material about the housing task force with the members listed. And this is, if you're a housing person, these are the people to be in touch with because they're getting ready to consider their recommendations. And this is a good listing of the topics that they've covered already. And then their final meeting, they're meeting today at 1 o'clock. So you can stay tuned to your computer and watch that on KET or on the LRC YouTube. And then they have their final meeting on November 24th. Next, please. And then you all will remember that when we go into the even numbered years, that's the long session, the 60-day session. And what's the thing that they have to do? Absolutely, they have to pass the biennial budget. And of course, for those of us that work on the budget, this really is the moral compass or the moral document of the legislature, just in the same way that you do your own budget for your household or for your business, and you put those top priorities right up there and make sure you've got money for that, and then they go down in priority. And our message is always put Kentucky's people first. Everything that has to do with the things we're talking about today, the safety net programs, put those at the top so that Kentuckians have every single thing that they need, whether it's healthcare or food security or housing, vaccinations, and so forth. So the budget review subcommittees are important to watch, and the final meeting date is November 5th for those budget review subcommittees and also for the Appropriations and Revenue Committee. And I think we have a listing on the next slide, Alex, of the, yeah. So most of us are looking at the Health and Family Services because they will talk about Medicaid, they'll talk about waivers, they'll talk about DCBS, they'll talk about housing and all of those things. So their meeting is at 10:30 on the 5th. And then a lot of people, like our friend Dustin, will look at the economic development, those forecasts, and how much money we're going to have to spend in that biennial budget. Next, please. So we've talked before about the Medicaid Oversight and Advisory Board, and this is the background to it, created by House Bill 695 in the last session. And we've been meeting for since June 25th. This is really a dramatic change for Medicaid. Medicaid has always been administered and decisions made out of the executive branch, out of the Cabinet for Health and Family Services, the Department for Medicaid Services, and the role of the legislature has been to fund the state portion of that. But House Bill 695 and the creation of the MOAB really shifts that. It really puts the legislators kind of in charge because there's a lot of reporting that has to be done. And actually 695 prohibits the Medicaid from doing certain things without the permission of that legislative committee. So think of it as a real shift in who's calling the shots, if you will, about Medicaid. Next, please. So the membership is interesting. It's quite a large committee. There's 25, but actually only 10 have votes, and those are all legislators. So it's co-chairs Julie Rocky Adams and Ken Fleming, and then it's the chairs of Health Services, of Family and Children's, and then two other legislators, Senator Craig Richardson and Representative Wade Williams, and two Democratic legislators, Senator Karen Berg and Representative Marzian. And then on the non-voting side, we have four more legislators, the chairs of A&R, and plus Senator Douglas and Representative Bowling. And then we were happy that they put the Medicaid commissioner on, Dr. Stack as the chief medical officer of the state auditor, the budget director. Four citizens were with Medicaid experience were appointed, two by Speaker Osborne and two by Senator Stivers, President Stivers, and then the head of the Rural Health Center, a representative of the managed care organizations. And then I actually have a seat on it as I'm the chair of the Medicaid Advisory Council. Next, please. Remember, all of those people don't have a vote, but we do have a voice. So this is very intense, and you're going to have to look at it when you get the slides. But I went through and kind of gave you an idea of the topics that have been looked at by MOAB, starting with an overview of the Medicaid program, and then, kind of setting the stage with an update on the federal changes and a report from the Kentucky Hospital Association. And the reason they asked for that, in part, was that Kaiser Family Foundation published a study that had been done in North Carolina, making a list of all of the rural hospitals that were at risk of closing. And Kentucky had by far the most hospitals on that list. We had 35 hospitals. So while we have 2% of the population of the entire country, we had 10% of the hospitals that were at risk. And I will point out that Nancy Galvani, who's head of the Hospital Association, said, "Oh no, I don't think those hospitals are going to close, but they may close services." And the services she mentioned about 3 times were OB services, birthing centers, and so forth, behavioral health services, which as a psychologist really hit home for me, and then emergency room services. So those are the services that hospitals don't make a lot of money on. So we have a meeting tomorrow afternoon at 3 o'clock, and we're going to hear from the auditor about a special examination that she did of Medicaid. We're going to hear some testimony on provider reimbursements and network adequacy. Network adequacy requires the MCOs to have ample representation of every kind of provider within a 30-mile or 60-mile radius. And then we're going to look at Medicaid regulations. There's one final meeting on November the 12th, and no agenda has been released. We're hoping that there'll be some discussion on recommendations. There's been absolutely no discussion about recommendations yet from MOAB. Next, please. So this is a link for all. You can watch it live on KT, or could go back and watch it archived. and all of the materials are there on the LRC website. Next, please. And just a reminder that you really have two ways to participate in and influence, if you will, our democracy. One is your voice and the other is your vote. So get ready, because 2026 is a big election year in Kentucky. All 6 congressional seats, all 100 Kentucky House seats, and 19 of the 38 Kentucky Senate seats are potentially on the ballot. So just a reminder that you can influence others to vote. It's a good time to concentrate on voter registration, because those primaries will come up in May and then the general election will be in November. But remember to continue to speak out. Kelly gave you some good ideas about speaking out with your federal representatives in DC. And again, all of the legislators, there'll be a special election for Senator David Yates' seat in September, but the legislators that you have now are going to be the legislators that are going to be voting on that budget and making all those decisions in the next session. So I hope you will use your voice and get people registered also. So I'm happy to turn it over to Dustin Pugel from KY Policy to talk about KTAP.
Thanks, Dr. Schuster. Yeah, my name is Dustin Pugel. I'm the Policy Director of the Kentucky Center for Economic Policy, and there have been a few announcements lately surrounding KTAP, which is our basic cash assistance program for very low-income kids and their parents. And we wanted to talk through really the announcement about the forthcoming cuts to this program. So let's move on to the next slide. Just quick background. Oh, interesting. I think we're missing a slide, but that's okay. So KTAP, there we go. KTAP was only just recently updated. Prior to 2023, there were benefit levels were roughly stuck at where they were in 1995. And unlike other public benefits programs, which are based off of, like a federal poverty level that adjusts with inflation over time, KTAP is unique in that it's based off a set dollar amount for income eligibility as well as the benefit levels. And so because both of those numbers had been stuck at levels that were previously set in 1995, caseloads had been dropping for quite some time. The work reporting requirement that has been a part of KTAP since 1996 was not adequately supported with help for certain types of activities. And eligibility rules were very outdated. And so, what you can see here is that eligibility was slipping for a long time. And so, a number of groups came together and reached out to the administration and suggested that we needed to update these benefits. And so if we go on to the next slide, there were 13 regulations that were changed, most notably one that dealt with the maximum benefit level as well as the income eligibility level. And so the income eligibility level was increased by 20%. The benefit amounts were essentially doubled, and that meant that they really just returned to where they were after you adjust for inflation in 1995. And there were a whole bevy of work supports. Some of the rules were cleaned up on who could become eligible, and earned income was rewarded through disregarding that income for the first 6 months entirely, and then having a 50% disregard for 6 months after that. And so what we saw was exactly what we were hoping for. Eligibility improved, and so a lot more kids and their parents were able to join the program. And it peaked about 6 months ago when caseload started to dip off again, which is normal, particularly because there are pretty firm time limits with this program. And so we're kind of seeing a dip off again. But all that to say that these changes did exactly what we were hoping they would do. And there was enough money in the block grant that pays for these benefits that we were able to maintain those benefit levels. If we move on to the next slide, just a few weeks ago, the Beshear administration announced that they would be cutting this benefit because there is a budget shortfall in foster care, which I'll speak about here in just a minute. And they needed to plug that hole. And so what they announced was that there would be around a 35% cut to the benefit levels, and that they would be cutting the transportation benefit from $300 a month to $150 a month. Just a reminder again, for the parents of young children who are on this program, there's a work reporting requirement, right? So they have to participate in work activities enough to qualify for the program, so they have to get to and from their job. That transportation benefit before the increase in 2023 was $200 a month, so it's actually being reduced to below where it was prior to that point. Kentucky won a national award for these improvements a couple years, actually I think it was last year, and we've seen a lot of recognition from other states about the way that we did this, but at this point we're moving back. So this chart shows kind of where things were from 1995 to 2022 for a 3-person household, where they were from 2023 until this month for the maximum benefit level, and then where they will be moving forward starting in November. So, this is concerning to us because, again, this is Kentucky's only basic cash assistance program, particularly for low-income kids who are often cared for by their parents, but are sometimes cared for by a grandparent or someone else in the family. And so it's really the only means of flexible cash assistance that we have to provide for these folks. We know that basic cash assistance has incredible benefits for children immediately, but also later into life. That research stretches back 50 years now. And so moving backward in order to plug a budget hole is concerning. We're worried about what that precedent might mean for other states, but also what it means for the kids who live here. If we go to the next slide, the rationale is that we need to plug a budget hole in foster care. I believe that that's true. I think there is a shortfall. It's not because the caseloads in foster care are exploding. It's more because of the severity of the cases that are coming into DCBS. They're requiring more intensive care, and that intensive care is more costly. We're of the opinion, though, that cutting basic cash assistance could be sort of penny wise and pound foolish, in that we know that the increase in poverty also increases the likelihood of being involved in the child welfare system. And so providing fewer resources to kids who are already in a vulnerable position could put their parents in a more tenuous position that could ultimately lead to more reports of neglect in the household. We know that poverty and neglect are often confused or intertwined. And so we're worried that, in the long run, this may be an issue that bites us in the butt. Having said that, we also are pretty clear that foster care needs to be adequately funded, and we're coming up to a budget session here shortly. So if we go to the next slide, I just want to say a couple things about where we are with our budget. Right now, Kentucky has a budget reserve trust fund of $3.7 billion. Just as a reminder, our entire general fund is $16 billion. So that represents nearly a quarter of our entire general fund. There is plenty of money to be able to plug a $35 million shortfall in foster care. Even if you put the budget reserve trust fund aside, this year Kentucky had a surplus at the end of the fiscal year, and we put $251 million additional into the budget reserve trust fund. So there is plenty of funding available to be able to deal with a program that helps the most vulnerable kids in the Commonwealth without taking funding away from a program that helps another group of the most vulnerable kids in the Commonwealth. And we're really hopeful that as we move into the budget session, foster care is fully funded so that we can restore KTAP benefits to the kids that they're owed to. Just a quick note to mention that there is a government shutdown in place, as you've already heard. That shutdown is affecting KTAP benefits. The governor announced yesterday that the state will use state funds to make the next KTAP benefit payment, which is owed in November. But if the budget shutdown lasts longer than that, then KTAP benefits would pause until there are federal funds available. So at least for the next little bit, KTAP families will see some benefit, although obviously it'll be smaller And then moving forward, hopefully healthcare subsidies are extended and we can get back to business at the federal level. So with that, I'm going to hand it off to Jessica.
Thank you. Hello, I'm Jessica Klein. I'm a policy associate at Kentucky Center for Economic Policy, here to talk to you all today about food insecurity and our food assistance programs. Next slide. So it should be no surprise that Kentucky is one of the hungriest states in the nation. We have about 16% of Kentuckians facing food insecurity, meaning they don't have enough access to quality food to help them thrive. That includes about 20% of Kentucky's children. We also have the second highest rate for older adults, so not doing great. Next slide. But our best tool against hunger is the Supplemental Nutrition Assistance Program, SNAP. SNAP has been shown to improve health and is very reflective of policy change. So you can see all of the changes in participation we've seen here in this chart, including a gap from the last government shutdown in 2018. The average SNAP benefit is $174 for a household. So again, this is very much supplemental and does not cover a full family's food budget. Again, about 13% of Kentuckians participate in SNAP to help make ends meet, but we are only reaching about 2 out of 3 of the eligible families in Kentucky. Next slide. And access to SNAP is about to get a little bit worse. Hunger is about to get a little bit worse in Kentucky. The One Big Beautiful Bill Act cut SNAP by $300 billion, which is the largest cut in history. And these cuts come in a couple of different ways, some that we're starting to see now, and I'm going to go into detail on those. But a couple that I want to highlight is the cost shift that we're going to see as costs shift onto states to fund SNAP. In Kentucky, we're looking between $50 million and $253 million to continue to fund SNAP. This is dependent on what's known as a error rate, and we don't have the numbers on that just yet, which is why we're looking at such a range here. It also ends waivers for the work reporting requirement and expands those requirements to larger groups of people. So we're looking at least 114,000 Kentuckians that have to do this additional reporting in order to keep their food assistance. It also ends some flexibilities and deductions in the program and ends eligibility for legally residing immigrants, and ends what's known as the Thrifty Food Plan, which was an adjustment for healthy food that's been taken away from the SNAP benefits. Next slide. So some of these changes that are happening right now, I want to highlight 2 are changes to deductions. So the first is the standard utility allowance. Most families will have to submit additional documentation to maintain that utility deduction, except for households with older adults and people with disabilities with LIHEAP. So everybody else needs to work on that utility documentation. The second is it ended the internet deduction, so we no longer receive that deduction in SNAP benefits. And all of these deductions go into a calculation that helps determine how much families receive in SNAP. The next pieces are a change in benefit adjustments. So there was a cost of living adjustment in early October, and there was also a recalculation for our program that simplifies applications for older adults, known as the SAFE program. So a couple of changes there that will impact benefits. The hope is that the increases from the benefit adjustments will kind of balance out some of the changes to the income deductions. So hopefully not as many households see a reduction as they would have, but definitely some will start seeing those soon. And to put a finer point on it, I did want to highlight that if the government shutdown continues, that means there will be a delay in November benefits. I know Kelly mentioned this briefly as part of the government shutdown information at the beginning. We are looking to Congress to obviously to figure this out between now and those reductions in benefits, but really I think it's past Thursday. If the shutdown continues, we will continue to see delays in those benefits. And there are contingency plans that could help continue that funding at the USDA level. So looking to them as well. And then I do want to talk more about work reporting requirements because those waivers are going to end in November, but I have another slide on that. So next slide. All of these cuts, again, will start to impact how much grocery money families have, but it also impacts children that receive school meals. So about 82% of our students in Kentucky qualify for free and reduced meals. And there is a program called the Community Eligibility Provision that provides the majority of free school meals to our Kentucky children. And that relies on both SNAP and Medicaid participation in order to make sure that kids are getting the food that they need in school. So we're going to see a reduction in that as well. Next slide. A little bit more on that work reporting requirement I mentioned. So the extension of this is to people 18 to 64, caregivers of children over 14, veterans, people experiencing homelessness, and former foster youth that are going to have to start doing this additional reporting of work hours to make sure that they keep their SNAP benefits. So anyone missing more than 3 months in 3 years will lose their SNAP benefits. And I mentioned the waivers. So there are currently 117 counties in Kentucky that are exempted from this because they meet certain economic standards. The One Big Beautiful Bill Act changed those standards. So we will lose our waivers starting November 2nd. So people will have to start doing that reporting in November. In the meantime, what people can do if they qualify for one of these exemptions listed here, be sure to submit documentation for those exemptions so that you don't have to do that additional reporting. Next slide. I also wanted to mention a little bit on SNAP restrictions. This is a topic that keeps coming up in the Make America Healthy Again task force that Sheila mentioned. These are initiatives that really restrict what people on SNAP can buy. And ultimately what we know is that limiting SNAP benefits means it's harder to use, harder for retailers to participate, and makes healthier food harder to access. So purchasing patterns don't differ between people that participate SNAP and people that don't. And this is not a proven public health approach to address nutrition. We do have alternatives to look at, so things like extending the Kentucky Double Dollars program, which allows people to spend SNAP dollars in their farmers markets and get extra fruits and veggies, is one that we would like to see utilized. Next slide. I also wanted to mention the summer EBT program. We have been sharing that in 2025, we reached almost 400,000 kids in Kentucky to make sure that kids get grocery money during summer months when it's hard to access food for kids because they don't have access to those school meals I mentioned. And how we can keep doing that is making sure that summer EBT is funded in the next Kentucky budget. We'd also like to see streamlined certification to make it easier to auto issue these benefits to Kentucky families. Next slide. And we do have some of the results from our summer feeding programs for kids. We've reached all 120 counties in Kentucky for the first time ever. So summer meals have reached more Kentucky families than ever before, which is great news. Again, we know that that seasonal food insecurity is really important in summer is when we really see child hunger increase. So it's great that we're reaching more families with these programs. In July, the average participation, for example, was 40,000 kids in 2024 compared to 2022, so a big increase there. Again, we are concerned about reductions in participation in these programs because of the reductions we will be seeing in SNAP and Medicaid participation. Next slide. I also wanted to provide a quick update on senior meals. I know that some folks have been following this, but we do have, again, I mentioned 1 in 5 seniors in Kentucky is hungry, so one of the highest rates. And in September, it was announced that the agencies that administer these programs had a budget shortfall and had to cease operations and start wait lists for senior meals. But luckily, in just a couple days ago, the governor announced that they were able to allocate $9.1 million to make sure that seniors get fed. So senior meal programs are back up and running. They might have to adjust operations a little bit for the next few months to stretch out that additional reallocation. But what ultimately this means is that we would like to see the state legislature have a higher allocation to senior meals in the state budget next year. And they also have the Kentucky Senior Hunger Summit coming up. And I do have an updated registration link for that. Thanks. Next slide. With all of these strains on our feeding infrastructure in Kentucky, resources are needed more than ever. So additional resources here for food banks and other emergency services. But again, we need these food assistance programs to make sure Kentuckians get fed. I think that's it for food. On to Sheila.
Thank you. So I'll put on my psychology hat and talk about behavioral health and the waivers. Next, please, Alex. Just a reminder that we talk about the social determinants of health or the environmental impacts on health. Well, that's also true of behavioral health. So those same things, poverty, food insecurity, lack of housing, social exclusion, and isolation, all of those also have a immediate impact on mental health and a risk of mental illness. Next, please. So Medicaid is the largest payer of behavioral health. And when we talk about behavioral health, we're talking about both the mental health and the addiction side. So the SUD and the mental illness. So the impact of those cuts that are going to be coming down from the OBBBA are really going to impact the availability of behavioral health services. When Kentucky expanded its Medicaid population in 2014, a large number of individuals came into Medicaid who had addictive disorders. And there was an increase of 740% in utilization of substance use services in the first 2.5 years of the expansion. So it's just tremendous that we are able to provide that. And of course, our concern is that with the work requirements for that expansion population and more frequent reporting that's going to come, that people are going to lose their Medicaid. The qualified health plans on Connect, which is our state-based marketplace, all offer behavioral health services as they are required to do by the Affordable Care Act. If premium tax credits are not continued, some 47,000 Kentuckians are projected to possibly lose their health insurance. And we are concerned about a proliferation of junk plans, or plans that purport to provide coverage but really don't. And the chances are that none of those plans will even pretend to cover behavioral health diagnoses and treatment. So again, access to treatment is going to really be much more limited. House Bill 695, which is the one that established the Medicaid Oversight and Advisory Board, also focused on behavioral health, and they want a regular report from Medicaid on any services that increase by 10% or more in cost each year. They also required behavioral health to resume prior authorizations, which are a mechanism that the payers use to restrict services and to save them money. They do not increase quality. And so we're going through that process right now, which means that as a provider, if I'm seeing you and I think you need a different service, kind of service, or an extension of the services I'm giving you, I have to get permission from the MCO or the insurance company. And it's a long protected interaction that takes me offline from seeing other clients. Next, please. So the exciting news about new behavioral health waivers that are coming. One population that has never had a waiver in Medicaid are those people with severe mental illness and may have a co-occurring substance use disorder. And that plan is called the RISE Initiative, was approved by Medicaid and Medicare in March. And we're hoping that it's going to begin rolling out in early 2026. It offers a range of services, including supported housing, which means that people will be monitored and reminded to take their medications and to attend their therapy sessions and so forth. We'll also offer respite to the families, which we've never had before. Another one that we've been working on for about 5 years now, and we're waiting to see it come to fruition, is to cover populations that typically lose their Medicaid because they're incarcerated. And this will focus first on prisons and on the Department for Juvenile Justice facilities. So 60 days before release, the individuals will begin to get services, medications, and get connected with their MCO. What we're trying to do is to make sure there's no gap in services so that when they leave incarceration and get into the community, they already know their MCO, they're already on their medications, and they have a contact with the provider. So we were hoping that it was going to begin in October of this year, but it looks like now it's going to be April of next year, but very exciting to have those services. Next, please. So you've heard me talk before about the 1915C waivers. Those are the home and community-based waivers. 33,000 plus Kentuckians use those to stay in the community and not have to go to an institution like a nursing home or an intermediate care facility. There was a huge advocacy outcry before the 2024 session, and we got more funding from the legislators than we've ever had before, funded 1,925 new slots or placements over the next 2 years. Unfortunately, all of those are filled, which is great, but we now have a waiting list that has grown to over 16,000, which is even larger than the waiting list was before the 2024 session. So we're going to have to go back to the legislature and really push for more funding. The other change in Medicaid that I think is very positive, CMS required every state to develop a beneficiary advisory council made up only of Medicaid members, parents, families, or caregivers. And so that BAC has been formed. They had their first meeting on October 13th. Emily Beauregard of KBH, who is a elected chair. So we're very happy about that. And they will be meeting every other month. And then on the alternating months, the MAC, the Medicaid Advisory Council, will continue to meet, but it's a greater opportunity for input from family members and from Medicaid members themselves. Very positive. Next, please. So I just want to draw attention to a population which has really suffered on both mental and physical health care, and that's the LGBTQ Kentuckians. Senate Bill 150 prohibited health care to trans youth to aid in their gender affirming care. Also made many significant changes in schools so that schools are no longer the supportive and safe environments that they had been. Trans students are required to use separate bathroom facilities. Schools are pretty much prohibited from using different names or pronouns, even if requested by the students' parents. And the trans population, just to give you some context, is about approximately 0.6%. So that's less than 1% of the population, but these changes will very much affect both their physical and mental health. In September of last year, Governor Beshear signed an executive order to ban what's called conversion therapy. It's really conversion torture. It uses a lot of very negative shaming and sometimes physically abusive techniques to convince kids that they are not gay. Unfortunately, when the legislature convened, they wanted to overturn that, which they did in House Bill 495. They also banned Medicaid payments for services to adults who were seeking gender affirming care. And then that same session, Senate Bill 2 banned the delivery or continuation of gender affirming care for any Kentuckian who was incarcerated. And then House Bill 4, which prohibited diversity, equity, and inclusion, obviously affects our LGBTQ students in post-secondary institutions because all of the special programs for them have been now outlawed. Next, please. So these are some of the statistics on suicide and self-harm. Any suicide is one suicide too many, but we do have alarming increases in Kentucky adolescents and college-aged Black males, also in suicides for people over 55, particularly among white men. And as you can imagine, in homes that have a firearm available, you have a much higher likelihood that there will be a successful suicide. So the fact that Kentucky is very much a gun-owning state really does not help with the suicide prevention work. We have a good program for farmers who also have a high suicide rate, and that's the link there. They are also working with the 4-H clubs and the Future Farmers of America to start educating kids, adolescents, in what to look for in terms of suicide. And again, the LGBTQ youth are not of their very makeup prone to suicide, but because of the abuse and mistreatment, stigmatization that they suffer, they're more likely. The Trevor Project is an excellent resource, and their crisis line is there. And we had increased the frequency of trainings for school staff, but that has been cut back in House Bill 48. Next, please. So the 988 line is still there and very, very important. I will point out that the option 3, which had been for LGBTQ individuals, is no longer funded. President Trump ended that in July, but help is still available through 988 and also at the Trevor Project. Next, please. This is an incredible resource if you have a family member or a friend, or you yourself are looking for treatment. This has absolutely up-to-date information about who's taking new patients, where there are beds available, what insurance they take, or what financial obligations there are. And it's current across Kentucky. So that's a handy one for you to keep at the top of your email list. And then how do you know if you need help? Just a reminder that these are very difficult times. And I'll remind you of the airlines, you know, the oxygen mask drop down and they say, put it on for yourself and then reach out and help others. So many of you are helping your neighbors and helping your communities, and it takes a toll. So I just want you to really be careful and to watch yourself and your loved ones. Screenings are available confidential through Mental Health America. And when in doubt, reach out for help. It's always better to catch a problem early. And I think that's the end. Yeah, I'll turn it over to Priscilla for Medicaid and Marketplace. Thank you.
Thank you. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Workers for Health. Today we're going to cover Marketplace and Medicaid updates, and a big focus on open enrollment. Next slide, please. So just to sort of set the stage, we've talked a lot about the One Big Beautiful Bill Act, those changes that are coming. And for the good news is that for Medicaid, we still have a lot of time before most of those changes go into effect. But on the Marketplace side, oh, folks are not
Priscilla,
me. Am I quiet or can you not hear me?
we're having a hard time hearing you. It's a little garbled and coming in and out. It's very quiet.
Okay. Unfortunately. How about now? Any
Cody
better?
thinks you might be noise canceling yourself.
That did sound better now, Priscilla.
Yeah,
That did sound better.
that sounds great.
Better.
That sounds great.
Okay. Okay. Sorry about that. Okay. Well, quick. I'm Priscilla Easterling, Director of Outreach and Enrollment. We're going to talk about Medicaid Marketplace updates and a big focus on open enrollment. So we've talked a lot about the One Big Beautiful Bill Act and a lot of the changes that are coming with that. The good news is that for Medicaid, a lot of those changes are still are not happening anytime or not happening till next year. But for the Marketplace side, there are big changes that are happening at the end of this year and are additionally complicated by another big change of those enhanced subsidies expiring that several folks have mentioned throughout so far. Next slide. So for those extended subsidies, our friends at KY Policy put together a great article that talks about how those costs are going to explode. The average monthly premium are going to more than double for most folks. The average jump is going to be a little over $181, which is a 135% increase in monthly premiums. So most folks are going to are going to end up paying a lot more for their insurance for the same coverage for 2026 as they had this year, but it's just going to be way more expensive. And so it's super important We're hoping Congress will pass a bill to extend those enhanced subsidies. There are two options, one that would make it permanent, and then one that is temporary that would extend it for 1 more year. Obviously, we would love the permanent one, but any harm reduction, any relief that we can give Kentuckians and families across the country now would be super helpful. So if you haven't reached out to your legislator, please do so. Next slide, please. A lot of the uncertainty about whether or not those enhanced subsidies are going to be extended has already caused CareSource to leave the marketplace for 2026. And so now, instead of 4 insurers, folks who are going through Connect for their insurance are looking at 3 options. Molina, WellCare, and Anthem are going to still be covering the state. There are a few counties that will only have 1 or 2 options, but most counties will have at least two options. A few will have, 3, a little bit more competition, but that's just that uncertainty. It makes insurers nervous, and we're already seeing rate increases on top of those enhanced subsidies. Not knowing whether or not those are going to be extended. Next slide. So keeping that all in mind, open enrollment for the marketplace begins November 1st. So next Saturday, that goes live. The state already sent out 75,000 notices to Kentuckians who are currently enrolled in marketplace coverage that shows them what their current monthly premium is, what their current premium tax credit is, and then shows them what the premium would be if they stayed in that exact plan stayed in that exact plan for 2026. I'll just go ahead and say this is not the year to let your plan auto enroll. If nothing else, just go in, check out the Connect pre-screening tool that also went live. It's linked there. It went live last week. Check out the pre-screening tool. Check out that notice. Make sure you know what your premium is going to be for 2026 and shop around. There are other options available in the marketplace besides the plan that you're currently enrolled in. Definitely take a look, go in and update your application information. If you need help doing that, you can either call the call center that's linked there, or you can reach out to a connector and they can help with that. It's super important. Don't just let your coverage auto enroll. Make sure you go in and check it out. For Medicaid, it's always open for enrollment. So members can change their MCO anytime throughout the year without cause. So you can do that anytime. And then we're also in Medicare open enrollment, which started last week as well and runs through December 7th. That's a great opportunity to shop and compare plans, and you can do that at medicare.gov. And for folks who have employer-sponsored coverage, always check with your employers about their open enrollment dates. Next slide, please. So one of the biggest groups that are impacted by that are folks who are enrolled in the Kentucky Employees Health Plan for state workers. Roughly 1 in 15 residents get their coverage through the KTAP plan. And for they're often seen as the canary in the coal mine. To Kelly's point earlier, there's no increase in the employee contribution, but we are seeing a rise in deductibles and maximum out-of-pocket limits and a sort of push towards higher out-of-pocket cost. So there are some changes that are happening there. Next slide. That just signal we're going to see higher out-of-pocket costs across the board. Even with flat premiums, state workers are going to absorb a lot of those higher front-end costs. And those changes that happen in the KHP plan often precede private market increases. So we're seeing that both in marketplace, we're seeing that with KHP plans, we're really seeing that across the board with open enrollment this year. So again, don't just auto renew in a plan. Make sure you go in and investigate and check out what your cost is going to be, both your premium, but also your out-of-pocket costs as well. Next slide. And with the rise of premiums, we often hear people say that they can't afford plans, and they'll turn to a helpful Google search. It's not helpful at all. It's often if you go to Google, you will most likely encounter a junk or scam plan. They're often those plans, they look affordable, but they're not real coverage. They're usually misleading. They're high-risk insurance products. They often exclude pre-existing conditions. They don't include essential services like prescriptions, maternity, or behavioral health, like Dr. Schuster mentioned just earlier. And they also feature like a very low monthly premium but have a very high deductible. And in practice, they can deny or cap benefits once care is needed. So you can pay your premium and then need to go to the doctor, and they can be like, we're not covering that. So if it sounds too cheap, or ask about your health insurance, your health history, it's not ACA compliant, please be aware. Next slide. Also, just to know how to spot a junk plan, if it's using using terms like low cost or instant, full coverage, limited benefits, but doesn't give any full details, any clear details. If it asks questions about your health history or pre-existing conditions, if they're using hard sell tactics like sign up now, limited time offer, or if you're Googling health insurance, they are often the top ads across the top that will connect you to these scammy or junk plans. That pressure to buy quickly or pay over the phone, if somebody calls you and like, give me your money, let's sign up right now, but they're not willing to give you any information, it's likely either a scam or it could be a junk plan. Just be careful. If it sounds too good to be true, it probably is. Next slide. So again, be aware of Google searches. All plans on the health plans on Connect include essential health coverage, benefits for prescriptions, hospital care, and more, have built-in consumer protections, no hidden exclusions, and they never ask about pre-existing conditions. So just be aware. Next slide. Make sure you're protecting yourself and others. Let other folks know that this is going on. Every time this comes up, we often hear a lot of people like, oh, this has happened to me, or that happened to a client. Let folks know what's going on so that they know how to be aware. They know what to look for. And if you need help, if you're ever nervous, you can reach out to a connector. They're free local experts in all 120 counties. Or you can also call the Connect call center or go through Connect. It's the only safe way to get enrolled in a Connect in an ACA compliant plan outside of employer-sponsored coverage. Next slide. So just a reminder, child renewals are back. It's super important. All kids who are currently enrolled in Medicaid have to go through a redetermination process this year. It went back to normal in July. It's really important to make sure your contact information is up to date and Connect. You can do that by logging into the Connect self-service portal to check your case information. And if you need help doing that, again, you can call the Connect hotline, reach out to a connector for help. You can also ask a provider at the doctor's office to check KY HealthNet portal to check those renewal dates. We have two helpful explainers, or we have a helpful explainer that walks through what folks need to know about that renewal process and what steps to need to take. It's available in English and Spanish. And then DMS put together a great renewal packet that gives a lot more context for what's going on, a little bit, and some additional flyers and resources to share as well. Next slide. And a very important reminder, income limits for children are much, 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 much higher than they are for adults. So when in doubt, fill it out. Do not assume that just because the adults are not eligible in a household, that the kids are not. For example, a household of 4, 2 adults, 2 children, for the income limit for the adults is $44,376, but for the children, it's $70,000. So it's really important to not assume that just because adults are not eligible, that the kids are not, because that limit for children is much higher. So make sure you're filling out the information, sending it back to the state. And again, if you need help, reach out to a connector. Next slide. And if you know folks who have gone through that process and lose their coverage, the first thing to do is to go in and update your application information in Connect. If you haven't done that, you have 90 days to still submit documents past the day of your renewal due date. You have 90 days from that date, from the loss of coverage, to submit information, and they'll be able to retroactively reinstate your coverage without a loss, without a gap in coverage. So super important. And again, if you need help, reach out to a connector. If you're outside of that 90-day period, you can always reapply. That is always an option. And if you, again, need help, reach out to a connector. Next slide, please. Just a reminder, so if you want to know more about the child renewals and what's going on from the state, they do a really good data deep dive about enrollment and the child renewal outcome, how many folks were approved or terminated. They do that at this monthly stakeholder meeting. The next meeting is November 20th at 11 a.m. You can register in the link that is provided. And the state also just gives other general updates about all of their other activities. So good time to check it out and hear directly from the state. So how can you help during open enrollment if you're not a connector? Make sure that you're having conversations with the folks in your office, within your community, with your family, everyone that you're talking to. Every conversation is a coverage opportunity. So, encourage people to go to Connect, share the pre-screening tool to estimate savings. That's also linked in there. Share information about junk and scam plans. Use plain language. If folks are talking about Googling health insurance, like, oh, maybe you shouldn't do that. What, have you checked out Connect? Sort of push them towards Connect. If it's not Connect, it's not Kentucky's coverage. Find and meet the connectors and SHIP counselors in your community so that you know who to hand them off to, hand your clients off to when folks need help. You can also connect families to local connectors. If you don't know who they are, there are 2 really helpful searches online that will help where you can find folks in your community. And then also fill out and share the Connect Story Collector, which is on the next slide, please. Our friends at KY Policy put together a great Connect Story Collector. They're trying to get stories about from Kentuckians experiencing those premium increases with this upcoming expiration of the enhanced federal subsidies during open enrollment. And so we want to collect those stories so that we can see what that real impact of rising cost will be and are for families as we're going into open enrollment. So it takes 2 minutes. You can share it with your friends, share it with your community, share it around. Every story matters, and we want to collect as many stories as we can. So share that out. Next slide. And then you can also, if you're interested in doing deeper dives about this, you can join the Keep Kentucky Covered Coalition. We meet monthly. Our next meeting is November 19th at 2 p.m. If you're interested, reach out to Alex on our team to join us. Next slide. And we have other health resources. So we have a great toolkit that we've put together that walks through one-pagers on work reporting requirements, economic impact on Medicaid, county by county enrollment data. And we also have other helpful one-pagers on kyloop.org about NEMT, special enrollment periods, immunization timelines, SNAP work reporting requirements, and healthcare language access, among many other helpful explainers. So go check them out if you are interested and want some more information about any of those topics. With that, next slide, and turning it over to George. Thank you.
Yeah, everyone. So my name is George Eklund. I work for the Coalition for the Homeless in Louisville, Kentucky as the Director of Education and Advocacy. I'm going to give a quick overview of where we're at federally and locally with our housing and affordability issues as well as homelessness. You can go to the next slide. So our system of housing really acts as an ecosystem where we have different housing options at different price points based on somebody's income. Our market works really well for those that are earning above 100% area median income, and it doesn't really work that great for those that are very low income, that are really just cash strapped constantly and trying to get by. Right now in Kentucky, for those that are earning less than 60% AMI, area median income, we need about 125,000 units of housing, both on the home ownership side and the rental side. And this is a statewide issue. You can go to this research and really dive into like your specific area of what your county needs. Next slide. So this is a snapshot of like what of our affordability here in the state. Housing operates based on supply and demand, where we have a demand at that lower income bracket. And because of that, that is part of the reason why we are seeing such high increases in rents. And that impacts the entire ecosystem, where if you can't afford it, you are forced into lower quality housing. You're forced to make hard choices between paying for medicine, food, energy, kids supplies, as well as your rent. And what does this mean? This means that more people face eviction. It means more people are vulnerable. It means more people are doubling up with families, and ultimately, like, more people become homeless each year. You can go to the next slide. So, really, one bright spot on the federal side of things is the passage of the Road to Housing Act of 2025. It is a bipartisan bill out of the Senate with Senator Elizabeth Warren and Senator Tim Scott, and it really looks to start speaking to housing supply, homelessness, manufactured housing, disaster recovery, as well as home ownership. I think this still has a long road to go, but it is a bright point in the grand spectrum of things that are going on nationally. Government shutdown. I don't know if you all knew that. We can go to the next slide. Sorry, Alex. So the government shut down, and we are really right now in the housing scene. We are at risk of, people that are receiving assistance are at risk of not having their rents paid if HUD runs out of money before they open the government back up, and also just a general disruption of housing authority operations and homeless services. Because what's going to happen if they lay off too many people at HUD? Providers cannot get reimbursed for the services, and so there's a lot of threats on the horizon that are associated with this shutdown. You can go to the next slide. There's also the federal budget, and right now we are looking at three proposals between what the president proposed, the House proposed, and the Senate proposed. At some point, they're going to reconcile all of these, but we, as a housing advocate, I'm looking at the Senate proposal as the best option that we have before us. So hopefully, at some point, they're going to reconcile the differences between these budgets as well, or pass a continuing resolution, which would just kick this can down the road further. You can go to the next slide. Another factor is an executive order that I view as a continuation of what we saw here in Kentucky around House Bill 5. It's a continuation of the Grants Pass decision. It is where we were continuing to vilify and dehumanize people that are unsheltered, that have no place to go. In Kentucky, we have about 4,000 people that are homeless on any given night. Kentucky lacks the shelter capacity to give people the option to even go indoors. And the executive order around ending crime and disorder on America's streets is really just this continuation of we're going to take away people's rights, we're going to take away their agency, and we're just going to lock them away and pay for it, but we're going to pay a premium for mental health services, for incarceration, where housing at the end of the day is the cheapest option for the majority of these folks. You can go to the next slide. And then, so that, along with the executive order from the president is a new threat on how the COC grant process is administered. For those that don't know, the Continuum of Care grant is a competitive grant that Kentucky does relatively well. Louisville, we are one of the highest scoring COCs in the country. And what HUD is starting to threaten to do, that are looking to do, is change the scoring system that we use, change the focus of what they prioritize for funding. So rather than funding permanent supportive housing, which has a 98% success rate, only being able to fund 30% of projects out of the COC can be permanent supportive housing, and really transitioning people to a short term, you get 1 year or 2 years of assistance. And such a huge shift in focuses and goals and priorities and scoring is going to be damaging to an ecosystem of homeless service providers that we've built over the last 10 or 15 years. Whatever, this is too much too fast, and is going to ultimately result in people being exiting housing back back onto the streets, and they're going to be homeless again. You can go to the next slide. Right now we have three priorities in the state house. We are advocating for the increase in the amount of money that goes to the State Affordable Housing Trust Fund. We are advocating for a way for people to expunge evictions off of their records. And we're working on a bill that would empower churches to open homeless shelters or housing by right without having to go through a zoning change. Right now, the Kentucky Affordable Housing Trust Fund brings in about $3.5–4 million a year to build housing for those that are 60% AMI and below. And it is funded solely by a deed recording fee and a mortgage recording fee. You can go to the next slide. We are advocating to modernize the trust fund by increasing the amount of money that goes to the trust fund from $12 to $36. What will this do? This will give us an additional $10 million a year and help us build 6,000 units of housing over the next 10 years. This is all housing that is the hardest to build from a cash flow and a developer's perspective. And these dollars can go directly to fund homeownership opportunities. They can go to fund low-income rental opportunities, as well as do some home repair work so that people can age in place. You can go to the next slide. In Kentucky, we have about 40,000 evictions that are filed each year. And each time an eviction is filed on somebody's, it lingers with them. It stays with them for years and years and years. And there is no mechanism to clear that off their record, like a mortgage or like a bankruptcy. It is just always out in the public sphere. We've been socializing this idea of letting people have their dismissed evictions automatically expunged off their record for a couple of years. And this year, I think we are hopefully going to see some movement on this bill. We presented in front of the House and Senate Judiciary Committee last week, and there was a lot of traction and a lot of resonance with that committee. We are really viewing this as a starting point of how do we empower people, how do we remove a barrier for people to access the best quality housing that they can afford. You can go to the next slide. And then the third priority bill that we're working on in the State House is the Yes in God's Backyard. So we're calling it the YIGBY bill. It's a play on NIMBY, not in my backyard. Then there's YIGBY, or YIMBY, there's Yes in my backyard. And now we have YIGBY, Yes in God's Backyard. This would simply allow a streamlined process for a church to develop housing by right if they fit a specific criteria and definition. It would also allow churches to open homeless shelters if they so choose as part of a ministry. This has a particular resonance in my neighborhood because there's a church that has an old school building attached to it. They want to develop senior housing, places for them to have congregation members or just rent it on the free market. But because of our zoning, they are not able to move forward with that project. So, I would love to see a vacant, underutilized space like an old school building attached to a church become housing where people are stably housed. It adds to the vibrancy of the community. It adds to the overall stability of our population. And so I really would love to see this bill pass this session. This is being carried by Representative Pollock and Senator Higdon. And a couple nuns saw this idea being filed by Senator Sherrod Brown out of Ohio, and they went to those two and they said, hey, can we do this here in Kentucky? And that's how this has come onto the scene. You can go to the next slide. So really right now there are three steps that I'm going to uplift. Right now federally, I would look to the National Income Housing Coalition or the National Alliance as your best experts on how you can support the work on the federal budget. There's a link to a sign-on letter and a toolkit, but those are the two info streams that I subscribe to just get the best analysis on the federal level. We are continuing to work on these state priorities. So if you are interested or have a particular story about people encountering barriers to housing because of a past eviction, please reach out to me. I would love to hear those. As well as in early November, in early January, we are going to have a housing advocacy day that we would love to have everybody join us to just talk about these priorities as we get ready for this upcoming session. Next slide. And I get to pass it back to Kelly. So thank you all.
Kelly had a committee meeting she had to run off to, so I'm going to wrap us up here today. Thanks everybody for joining. Again, apologies for the Zoom bomb earlier. We're going to find out a way to prevent that from happening moving forward. We'll also be sending out a recording of the slides, and we'll make sure that that's not a part of it, obviously. All right, let's move on to the next slide. There are a few more opportunities for state and federal safety net policy updates. We have a roadshow coming up in Richmond on November 4th. On November 18th, we'll do another of our quarterly virtual forums with the Cabinet for Health and Family Services. And then on December 15th, if you weren't able to make it in person to one of the roadshows, we're going to do a virtual version of that. So it's a little bit longer than this webinar. And a little more robust. So hope you can join us there. We also have quite a few explainers that we have available. If you need those, please use the link here. There are several resources available for folks. And most importantly, if you came on seeking out CEUs, we will be sending out an evaluation link afterwards. Make sure you fill out the evaluation in order to get your CEUs. We're really glad you all joined us, and we hope you have a great rest of your day.